as a physician in New Jersey, right? You're a service provider, like a lot of service providers here. And then you moved
A
to.
groveling grantee.
That's right.
Yes.
That's right.
Remember that world?
You went from there to lead the health departments of the city of Philadelphia and San Diego County, and then you left the glamour of government to become the CEO of TCE. So talk to me about that journey. What were the biggest surprises as you went from one sector to the next, one job to the next? What did you not expect?
Um, yeah, so some of you have heard this story from me before, but I'll just for context purposes, because if you're in this room and you're in this work, you're really about the business of change. Maybe not just charity, but change, right? And social change. And so for me, I was perfectly happy practicing as a pediatrician in the mid to late 80s. I was doing the work that I grew up imagining I would just do for the rest of my life. And it was the crack cocaine epidemic that turned things on its head for me, because before crack cocaine, poor people couldn't buy cocaine, they couldn't afford it, and then crack got invented, and the affordability of cocaine went from $100 and up down to $5, right, for a quick dose. And what happened as a result of that introduction of the crack cocaine phenomenon into low-income and distressed communities, like the community I was serving at the time on the East Coast, outside of Philadelphia, was homicide rates went through the roof, youth and community and family violence went through the roof, child abuse and neglect went through the roof, prostitution went through the roof, sexually transmitted diseases went through the roof, infant mortality and child infant premature births all went through the roof. If you look at the mid-1980s, you'll see all of these indicators kind of track going upward across the country. It didn't matter whether you were in Camden, New Jersey, or North Philadelphia, or St. Louis, or LA, or Detroit, or Chicago, or Birmingham, Alabama. It all kind of tracks going up around that time. My reaction, sort of as a practicing pediatrician, kind of fell in the category of what the hell's going on here? What is this? And what I was being introduced to was the intersection of hopelessness and poverty and health, right? So I was kind of very happy, sort of doing retail medicine, serving a family, serving kids, providing care. But this other thing was happening that was undermining all of what I was trying to do. That was completely out of the control of my office, and even the best care we could probably provide. And that led to that there was something bigger going on upstream that I wanted to be a part of. And I wasn't sure exactly sort of how to get there. So it took me 6 or 7 years actually to make the shift from the practice of pediatrics and serving kids and families into going more upstream and getting into some policy and public health work, which I did. Initially I thought the holy grail of policy work would be Washington, D.C. And as it turned out, I ended up, the job I could get that I could get excited about actually ended up being in the local health department in Philadelphia. I actually interviewed for a job that I really wanted, which was funded by the Pew Foundation, Pew Charitable Trust Foundation, around the Child Health, Child Wellbeing Initiative, public-private sector partnership. I thought the job was perfect for me. I interviewed for the job. They told me I was getting the job. I woke up one morning, looked at the Philadelphia Inquirer, and saw that they actually gave my job away to somebody else, who in a political thing, right? It was somebody who was a friend of the mayor, who actually was a friend of mine, I said, oh, that's really, I was reading the articles, oh, that's really cool. Wait a minute, that sounds like my job. So because I had interviewed with the health department director to get the Pew job, because he was part of the interviewing panel, he called me next and said, listen, have you read your newspaper yet? I said, yeah. He said, why don't you come in to see me tomorrow, because I think you're somebody with a lot of talent, and we might want to have in a health department. So that's how I got to the health department, was by a job I didn't get, right? Worked with local government. My biggest surprise there, Mitch, was I was surprised at how intensely political everything was. How both the combination of both bureaucracy and politics, bureaucracy, that big giant behemoth elephant that you just can't turn the direction of it without, enormous skill and force. And I was also surprised at how little it's interesting, because I'm going to say two things that are in direct opposition in the same sentence. How much money government has and how little flexibility they have. I mean, those of you that have been in government, you know what I'm talking about. There's a lot of zeros after those budgets in those line items, but it's all kind of it's Title V, it's Medicaid, it's Title, it's already kind of, it's decided on how it should be spent, right? So by the time the dollars kind of get to you at the local government level, there's actually not a whole lot of thinking that can go on around how you use that money, right? The thinking is more, okay, who gets the contracts or not, right? So I was kind of struck by how hard it was to move a reform agenda within the walls of government, and I had some successes and some failures there. So that was my biggest surprise there. The last part to this new role in philanthropy. My biggest surprise in philanthropy has been the mismatch. I know this is part of the topic of the conversation this morning. The mismatch between how much we talk about risk and how little we do of it. We talk about risk like it's a good game to talk about it, and we talk about risk and innovation a lot, but in reality, it's abundantly frightening and scary to our field. And so we can talk more about sort of how that plays out and how we try to deal with that. But those are sort of the surprises for each one of the career stops I've had.
And when you went from one sector to the next, what did you miss? What did you miss about seeing patients? What did you miss about government?
Seeing patients, there's nothing, those of you that do direct work with children and families, I mean, it can make your day, right? I mean, you can have one thing that just makes your day, right? That just reminds you, that's right, this is why I'm doing this, right? You see a family turn it around, you see a kid turn it around. That's where the resiliency is there. It resides there, right? So I certainly miss that. In government, I don't know if I've missed anything in government.
The answer could be nothing.
Yeah, that's a hard one. The thing is about government, both the elected and non-elected side, is how easy it is to go native. If people get what I mean by that, with the bureaucracy you get into, you can go in with the intentions of the kind of reform that needs to happen, and then you get in there, and it's just really, really hard. Even when you have the ear of someone who's at the top, and so the one thing I do miss is the regular back and forth that I had with the elected officials that I served in the case of city government, the mayor and his deputies, and in the case of county government, the county supervisors. I do miss like getting in their heads, right? Because you have to get into the head of the elected official that you're serving. because you have to understand that operating system, right? Each of them have an operating system, and the three rules of the operating system are get elected, stay elected, seek higher office, right? So you have to figure out how your agenda, in my case, how do I help kids and families from distressed communities? How does it work inside that operating system, right? And that's where you see the opportunities for reform. And then lastly, it's a very simple rule, make your boss look good.
Yeah. And in your current job, whose head do you have to get into? Who heads?
Yeah, well, the board. I mean, I'm not a solo. I'm not Eli Broad, right? I'm not Warren Buffett. That's different, right? Eli Broad only has to get into Eli Broad's head. Warren Buffett only has to get into Warren Buffett's head. I can't afford the luxury of just getting into my head.
Yeah.
I have a board. And so fortunately, the board of the California Endowment was, it was a new foundation, relatively new. Not a lot of history and not a lot of rules. And to this day, I'd like to think that much of what I do in terms of leadership and what we do in terms of shared leadership with the board is driven by a set of values, which for me, that's when leadership is most user-friendly, is when it's from a very strong sort of values perspective, and you're actually operationalizing values and beliefs and principles. And it's not so tactical and not even necessarily strategic. Because if the values and beliefs and operating principles are strong, then the opportunities and the tactics become easier because it's strategy and tactics towards a certain end of executing a set of beliefs and values, right? And we can talk about examples of that, but that makes it a lot easier. If you don't have a strong anchored set of values and beliefs, then it just becomes a more tactical job, and then it's a less appealing leadership role for me. Does that make sense?
It makes sense to me. It sounds like what you're talking about is building culture. Is how you and to reflect your values. And I'm interested in your leadership style and how your style has changed. You went from one sector to the next. And I was reading, you said that your favorite definition of leadership is hope in action. Can you talk about what that looks like?
Yeah, I mean, I love that definition. It's 3 words. Hope in action. It means anybody can be a leader.
Yeah.
And you can find leadership anywhere. It's a very assets kind of definition. It doesn't require stature, or it doesn't require being at the top of an org chart, or even being on an org chart, right? And so, we see it all the time in our grantees. I did a site visit 10 days ago at Crenshaw High School with a woman who runs a small program called Mother of Many. And what she does is she combines science and gardening. And she takes unwanted properties in public schools like at Dorsey High and at Crenshaw High and turns them into real gardens, but lifting up issues of science and technology for the young people there. And she's working with brown and black kids who could use that kind of inspiration. And so her ability to I marvel at her ability to get the blessing of the Los Angeles Unified School District and get property on a school ground and work in a positive partnership with the principal and affect the lives of kids, at the same time bring a new kind of culture to the thinking of the district and that institution. So that's hope in action, right? And not a big giant program.
And I was thinking about, because for people who don't know, I worked at the California Endowment, and I was thinking about my experience of you when you joined the Endowment, because I was there for 2 years before you, and what life was like after you came on. And
is that why you left?
Well, I left. I stuck with you for 6 years.
Oh,
It took a long time. No, um, and my experience of you and when you came on was like it was like a series of exhaling. It was like things are going to be okay because things were not good when you came on board. And I always think that like the I was there for 18 months before you got there. I had 3 CEOs, a bunch of vice presidents. It was not a good time. And the guy who was there before you, I would always say he kind of stopped the bleeding, but you let us heal, and you let us know that we could thrive, and that was really valuable. How did you do that?
well, that's the first time I've heard that from you, Mitch. Thank you. I appreciate that. I don't know. I think that back to the values thing,
Mm-hmm.
right? If you're clear about the values and you operationalize them, right, in sort of all that you do, or try and express them in at least most, if not all, of what you do, and you're transparent about that. Over time, you either convince people, or you bring them along, or you wear them down, right? And so, I it's probably it's probably when you turn your head. But these things, if you turn your head.
Okay.
Um, Thank you. So it really is transparency about a set of values that speak to people. In this kind of work, this is a room full of people who want to make a positive difference in the lives of people that are less fortunate. Right? Pretty much to a person, if you're in this room, you're somewhere in that equation. Right? And so, those values are of, authentic, deep, engaged listening, respect, dignity, passion, energy, optimism, not naive optimism, but optimism based on evidence. And so, I felt that was my compass when I had the interview with the job at the foundation. That's kind of what I heard. I said, well, if you really believe that, then I think I'm your guy. That's what I'm going to bring. And so, I continue to try and do that. And what's interesting, this is the only job. The other jobs I've had, both when I was a pediatrician, when I went to the health department in Philly, I went to the health department in San Diego. At about the 5 to 7 year mark, I ended up getting a little itchy. I felt like I needed a new whatever, right? And I've been in this one 15 years, and this is the only job I've had where I've been in it that long. And getting out of bed in the morning is no less passion than my first day I showed up. Mm-hmm. Right? And so I'm a big values person, and I'm a big passion person. And I'm okay showing that. Mm-hmm. And maybe that's what people read and saw. You would have to, interview them to find out. And so the combination of people who were at the endowment, who I knew wanted to operationalize that passion and set of values, and the grantees we were working with, like, what's not to love about that, mm-hmm. Right? And then having $3 billion in the bank helps. Right? It's not bad work, right?
No, but having $3 billion in the bank and no vision is not good.
Yeah.
And that's what you provided us, I think, was a vision, amongst a million other things.
No, thank you.
But not everything was great all the time, and you came on, and soon after you came on, 9/11 happened. There was a downturn. There was right sizing. People had to be laid off. When you talk about your values, how does your moral compass, your values, how does that kind of direct you when things are really going kind of sideways?
Yeah, I appreciate the line of questioning, Mitch. I have to say, this job, even the day after 9/11, even in the middle of the downturn, was still the best job I've ever had. Right? So I don't want to, I wasn't crawling through trenches, dodging bullets, mm-hmm. doing this job. I think my biggest, and this goes back to the boardroom, right? Each one of us here has a board that's overseeing something we do. And I find that a collective sense of it, mm-hmm. what is the it that we're about, is just sort of critical and breathed through the organization. I would say I was learning on the job. The board, when they hired me, hired someone who they could have hired bigger names, sort of coming out of the field of philanthropy. They took a shot on me, and I'm forever grateful about that. I would say that a couple of things along the way. One is coming to California was a big deal for me. Even the time I came, which was a bad time in California, this was like Prop 187, it was Prop 209, it was 7 or 8 years of budget cuts in the state budget. I still felt like California was the place. I had this either naive or well-informed point of view that California was the place to show the country how it gets done, right? It being equity, equality, opportunity for distressed and marginalized communities. So that belief, there was nothing that was happening, even when Prop 187 happened, there was nothing that dissuaded me from that notion and that point of view. And so here I was at the helm of the largest health foundation in the state that I felt had an opportunity, and still do, to show the nation and show the world how this happens, right? And so not for a minute did I lose sight of that, right, number one. Number two, the board had 16 or 17 varying views of how we should focus our impact. And it took a while to kind of bring all that together. But I'll give you an example of a conversation we had way back then that didn't show its head until recently. And this is about risk. And sometimes risk is not the big risky thing out there that's visible out in the world. Sometimes risk is just having the right kind of conversation. Sometimes even conversations are risky, right? So here's a conversation we had about a year after I joined the board. And it had to do with spending. We had one board member, Harold Williams. Some of you may know him. Harold was highly regarded attorney, ran the Security and Exchange Commission, then went to the Getty, and was on our founding board members. And Harold was a brilliant visionary thinker. And his view was, and to this day, I don't know whether he really meant this or he was saying it to be provocative, but I couldn't tell, right? His view, which was very much a distinct minority view in the boardroom, was that foundations should spend down. Okay? He felt that the perpetuity thing made foundations risk-averse, crusty, rusty, and dusty, and we should pick a couple of things and go after them with a resolve and spend the money. And that the markets and the economy would create new wealth. That was a very different point of view than any of the board members. And I was kind of too new to philanthropy to have formed an opinion about that. I was kind of like, that's interesting. So we had that conversation, and Harold didn't get his way. But where we landed was, okay, we're gonna be a foundation of perpetuity. We're gonna stick to the 5 to 6 to 7% spending of the assets. But should a momentous opportunity to advance our mission show up, we should jump in with both feet. And if we need to overspend, we should overspend. And so every now and then we would sort of have that conversation, and it never materialized until the Affordable Care Act showed up. And when Obamacare happened, we realized we had an opportunity to, our mission was to assure better access to health care, or part of our mission to assure better access to health care for underserved populations. And here comes Obamacare. Whether you were a hater or a lover of it, it was the law, however controversially passed, and the opportunity was in front of us. And we saw we had an opportunity with excellent execution to significantly reduce the number of uninsured Californians. Okay? So there were 7 million uninsured Californians 3 years ago. There's 3.5 million now. We're halfway there because of the execution of Obamacare here in the state of California and Medicaid expansion. And so when the law passed, I took that conversation to the board. I said, listen, 10 years ago we had this conversation. We now have a once in a 50-year shot to significantly reduce the number of uninsured. We've never overspent in a significant way. I think now's the time. If we're ever going to do it, like, what are we waiting for? Mm-hmm. And so we had that conversation once before in the boardroom, and it felt like the time was right. And the board approved a $300 million plus multi-year, which was probably a 50% spending increase over a 3 to 4 period of time for us to help support the execution of Obamacare, right? Which was, it didn't seem necessarily, you could say, well, that makes sense. You could say, wow, that was kind of risky, right, to overspend. But we did it, and we like what we've gotten out of it. Mm-hmm. The board is happy. If they're happy, I'm happy. But it's an example of sometimes you just have to give yourself space with your board and your senior team to have a conversation about risk, mm-hmm. right? About doing something different that you've never done before. And then once you've had that conversation, oftentimes the opportunity may not be that moment, but it may show up. Yeah. And in this case, taking the risk to have that conversation, even though Harold Williams didn't get his way then, mm-hmm. served us, a decade later.
Interesting. So I'm interested in how you think about risk even before you bring it to the board. So talking about ACA or building healthy communities, do you want to explain I think probably most people know what that is, building healthy? Maybe you just want to explain real briefly.
Yeah, so we, in our early years, the foundation was birthed with millions of people in the delivery room, right? Because it was a very public thing. Blue Cross of California decided to flip the switch to go from a nonprofit health insurance company to become a for-profit. It was at a time when a lot of America was like, wait a minute, for-profit healthcare? Wait a minute, what's going on there? What's that about? So it was, now it's normal, but it wasn't normal back then, right, in the 90s. And so we weren't the first, but we were the largest and most visible of those conversion foundations, right? And it was a big fight over whether Blue Shield should be able to do this. Blue Cross should be able to do this in the first place. B, evaluating the assets of the then nonprofit Blue Cross and how much money are we talking about, right? C, who should control those dollars once it becomes sort of aggregated to be given back to the community as community benefit? And D, what should the new thing focus on, right? So you had all this stuff swirling around. And so politically, what ended up happening was a significant dollar grant-making target was given to the new foundation. Get the money out, right? So this, we didn't start out with $3 billion, but anyway, this $2 to $3 billion foundation gets created. And by the way, you got to spend $200 million in the first 18 months. That may not have been the exact figure, but it was something like that. And so we kind of became this kind of grant-making machine without a personality, mm-hmm. right? Without an identity, right? And we got a lot of money out and in virtually every issue that faces, low-income Californians. Each of them worthy by itself, but it was clear that by the time I got there, the issue of impact was really like, how are we going to get to impact if we're a mile wide and an inch deep? And so I knew that was my job to get sort of the foundation to a place of impact. And what we did was the board let me kind of grow and learn and bump into the furniture. But I said, okay, let's get there, but let's build off what we're learning and build off what we're doing. Right? So we're very clearly about prevention, low-income communities, community health, and well-being. We had some populations with some particular focus, like farm workers, immigrant health. And so it was clear to me that we needed to combine the work of community and the work of place with a policy strategy. And that prior to that, the policy work was kind of in that corner, and the community work was sort of in that corner, but they weren't doing this. But there were a couple of opportunities where they came together, and when they came together and did this, impact. Okay? Like children's health coverage, like the childhood obesity work, like our community clinics work, right? So we had work in place, insights, envisioned and passionate leaders working on the ground, kind of showing a new way, but then linked to a statewide policy strategy. And it was clear to me, okay, rather than having that sort of as an accident of our birth, can we get really strategic and intentional about marrying that? Can we marry the power and passion of place with a strategy narrative, right? And that became Building Healthy Communities. Let's do 10 years. Let's not fool around with 2 or 3 year grants. And let's pick a few things underneath that umbrella and see how far we get. And so that became, we're now 5 years in. And we're pretty happy, generally speaking, with how things have gone. We're still sort of getting the lessons at the halfway point, at the halfway mark. But when we've done best is when we've been really authentic, hard listeners, like leaning in listening, not listening as ritual, right? Leaning in listening. I can give you a couple examples of this. To community leaders, their vision for a healthy community and sort of what needs to happen. And then marrying that with being, which is the other thing I've learned in philanthropy, is being willing to spend the brand and reputation capital of the foundation. Because grant making is one resource. In all of our institutions, whether you're corporate, whether you're a nonprofit, sort of the dollar value of the resources you invest is sort of one thing. But then there's the brand and institutional capital, and each of our organizations generally have some, right? And so what if we could sort of capture, and this is what I had found in my experience, Mitch, which is probably the biggest risk barrier, is that we in the foundation world tend to spend, there's a lot of caring and nurturing and feeding and protection of our brand, but we don't spend the brand. We don't spend the institutional capital. And it has some value in some places, right? And so an example of that is healthcare for the undocumented, where we were not only funding grantees, but we decided to use the bully pulpit and the institutional brand and the reputation of the foundation to say we're going to buy ads, we're going to put our name on the bottom of them, and it's going to say health for all, and that's operating from our belief system, right? And we know we're going to get hate mail on Monday, which we do, but we're operating from our values and our belief system, because our mission doesn't say address the health needs of the underserved who happen to be legally here. It says address the health needs of the underserved, period, full stop, end of paragraph. And if there's politics around being undocumented, not our problem, your problem. Our mission, our job, if we believe in those values, if we're invested in that belief system, are we willing to spend money, capital, and brand in service of that, right? So, I can give you sort of more examples of that, but that's how we tried to marry strategy with beliefs and values, and actualize and operationalize them. And when you can have a conversation in the boardroom and at the staff level about how that fits together, people will invest in it and believe in it and buy into it.
Yeah, so I want to ask you about your process to try to figure out, is this a risk worth willing to take? And it sounds to me like you're saying that if you're driven by your values, about your core, about your mission, then you'll just know, right? Or are there things that maybe risks that you have chosen not to take that might have even aligned with your values, but just thought, no, that's just too risky? And how do you how do you balance the risk and the benefit?
Yeah, I mean, there's always a pragmatism to this, right? Because it's not the risk of just setting your hair on fire about an issue and running down the street, right? And hoping something good happens. It's okay. What is the policy or systems landscape on this issue? So let me give you an example of someone when I walked in. Was the woman that was passionately breathing fire about the homeless issue in children, okay? So let me use that as an example, if I can. Right? So here's the narrative. The narrative around homelessness is it faces a twofold barrier. There may be even more barriers. One is too big, too hairy to fix, right? So that's sort of the pessimism barrier. Then there's the money. Where's the money going to come from? And then you have the stuff I talked about in my previous life, which is all the bureaucracies and politics that have to be sort of lined up. Right? And I've heard this issue too from the early childhood advocates, right? Because early childhood advocates are. So here's what I issue a plea for this audience in terms of our experience and my own lessons. Addressing issues like homelessness and early childhood investments, you will hear people in our sector talk about the need for evidence and the need for data and the need for what works and the need for innovation. I think that's mostly, not completely, I think that's mostly nonsense. Okay? This is not an innovation problem. This is not a science problem or a data problem or an evidence problem. Okay? We know what works with homelessness, really. We may not know everything we want to know. We know what works. Come on now. This is a will problem. This is a political problem. Right? So, by contrast, when the crack cocaine epidemic hit, the nation's response was not mental health and drug treatment expansion. The nation's response was 3 strikes and you're out. On Monday, it was a bumper sticker. On Tuesday, it was a campaign slogan. On Wednesday, it was national law. And 40 years later, the state of California, since 3 strikes and you're out, has built 22 new prisons and 1 new college. Okay? And so, when I hear about, we need more science, we need more evidence, we need to, crack more papers out and get them in front of the elected officials, as if, the pristine paper that talks about the evidence-driven, cost-saving support, we just get it in front of the city council or the board of supervisors or the legislature, and elves will take that scientific evidence and turn it into public policy just because they're nice, right? It doesn't work that way, right? This is a will problem, right? And so the will problem in this case is, okay, I'll give you a concrete example. There is someone can correct me on the dollar figure, I think a $2 billion proposal in front of the Board of Supervisors here in LA about building a new jail. Okay? I think it's $2 billion, it may be a little less than that. So this is, okay, so do we need it? Really? Let's program that $2 billion for community-based mental health and supporting services that we know works. And instead of adding, refurbishing it, now I know prisoners need better conditions, all that stuff, but I'm using that to make a point, okay? So what I get are proposals, and this is what kind of makes me crazy, although I understand it, for, the $100,000 proposal to expand, a few more beds in that supportive services program. And the prison system has your $2 billion. And it's a lack of will that we can't get there. This is why we fund advocacy, okay? We fund some direct services, but we try and fund it in service of advocacy because if we cherish the values as a state that we do, why are we spending more money on prisons than on higher education? Explain that to me. And what would it take, and I know we're almost out of time, right? So here's my plea. I think our sector which some people call the nonprofit sector, which I hate that name. I think we should reject that name. I think we should never use it. I'm sorry, Regina. You know, there's not a lot of vision when the first three letters is non-something, that you're kind of apologizing for something you're not. Some of you term independent sector, I guess that's okay. Here's the term I want to use. You guys ready? The Delta sector. Because we're about positive change. And the reason I say that is because, and particularly the millennials, you know, are you 40?
Yeah.
So those of you that are 40 and under, you guys have a different view, and it's a very healthy view, about social change. And it's not this, you know, the corporate sector just makes money and the nonprofit sector just does charity. I think it's the millennials that are forcing us to rethink that you can be part of the Delta sector if you work for J.P. Morgan Chase or Union Bank, as well as you could if you work for Homeboy Industries, right? That we're sort of in this together and we're crossing boundaries, and what was traditionally the nonprofit sector is becoming more socially enterprising and advocacy-oriented and change-making in its orientation, and the corporate sector is doing a better job of building philanthropy into its business model, right? And so that's for me, that's the Delta sector, right? And I think we need to be unified in a shared vision of what we all stand for. Why do we have this sector in the first place? Paraphrasing the Pope says communism gives us equality without liberty, and capitalism gives us liberty without equality. It's the job of the Delta sector to fix that problem on the capital side, right? And so I think a full-on frontal assault on inequality and lack of opportunity is the job of our sector. No matter where you sit in that equation, whether you're in the homelessness side, someone else is in early childhood, and someone else is in schools. But I think we need to have a shared sense of that's why we're in this, that's why we do this work, and that's why we're doing it together, even if we're doing it from the silo. And I think the systems and like the dollar spending, you know, what we spend. This is why we do advocacy. We do $150 million in grants a year. That's less than 0.3% of the state Medicaid budget. It's budget dust, right? So we've got to get to a conversation where existing public dollars need to be in a values-driven and evidence-supported way get to where we need these dollars to go. And it's going to, in order for that to happen, we're each going to have to raise our game around risk. It would take all of us. How many of you have ever been to a county board of supervisors meeting? Okay, so maybe a quarter of you. So all of us would have to show up at the next county board of supervisors meeting saying, forget about the $2 billion for the jail, we want community-based mental health services. Right? It would take that kind of, does that make sense?
Yeah. So
we're over time.
We are over time. So we started talking about your different sector work, and then we ended up talking about how the sectors can come together. And I don't think there's anybody out there who can inspire this group like you can. So thank you, Bob.
Thank you, guys.